Hi and welcome. Today we are going to talk about the power of nitric oxide, specifically 6 evidence-based techniques that you can use in clinical practice. Hi, my name is Dr. Arianne Missimer. I am a functional medicine practitioner, a doctor of physical therapy, registered dietitian, mindfulness instructor, and I am the owner of the Movement Paradigm Integrative Health Center. So nitric oxide is one of our most crucial molecules for bodily functions and overall health. One of the things that is known for the most is vasodilation. So of course, this can affect so many different aspects of our health, from erectile dysfunction to cardiovascular health to even how we're able to get our blood and nutrients to our cells. When looking a little bit more in depth about the specific benefits, one of the things is blood pressure regulation. So a lot of the research that's been done with nitric oxide has been done in hypertensive patients. We also want to think about its ability to reduce platelet aggregation. Essentially, it is increasing cerebral blood flow. So this is really important as we're thinking about more blood flow and how we're actually getting our nutrients to our brain. Vascular function. So again, as I mentioned, this can be associated with erectile dysfunction. So in order to have an erection, as well as even for female sexual health, it is very important to have optimal vasodilation. In addition to that, it is going to reduce oxygen costs during exercise, so it can have an impact on performance. It can affect the mobilization of circulating angiogenic cells, therefore affecting bone marrow. It can affect mitochondrial function. And of course, as it relates to physical exercise, it can increase, as I already mentioned, the performance overall, but also reducing oxygen during exercise and enhancing muscle contractility. So now let's get into the different nitric oxide pathways. So there's 3 primary pathways, and then there's one alternative pathway. So the first pathway is called the NOS pathway. So this is nitric oxide synthase pathway. It's the most well-researched pathway, and it is something that we lose the ability to make nitric oxide via this pathway as we age. The second pathway is the enterosalivary, which is nitrate to nitric oxide pathway, which happens via the posterior tongue with our anaerobic bacteria. And then there's the nitrite to nitric oxide pathway, which happens via dietary intake when we have nitrates that are present in the blood that can be converted to nitric oxide during hypoxic conditions. So this is something we won't go in depth today, but we will talk about the other 2 pathways. And then the last pathway, which is the alternative pathway for nitric oxide, which happens via the parasinuses. So let's start with the NOS pathway, which involves the enzymatic production of nitric oxide from the amino acid L-arginine. So essentially, we're going to start with the NOS enzymes that are present in various cells throughout the body, and that's going to catalyze the production of nitric oxide. So there's 3 different isoforms. There's an endothelial, which is eNOS, neuronal, which is nNOS, and inducible, which is iNOS. The NOS enzymes use L-arginine, oxygen, and NADPH as substrates to produce the nitric oxide. There's different cofactors involved in the process, and once activated, the NOS enzymes are going to convert L-arginine into L-citrulline, with the byproduct being nitric oxide. So then the produced nitric oxide is going to quickly diffuse from the endothelial cells into the smooth muscle cells in blood vessels. And through this, we're going to have signal transduction resulting in an increase in cyclic guanosine monophosphate, which is cGMP. Then this creates the vasodilation effect. So this is going to lead to a series of reactions that causes the smooth muscle to relax, which is what is known as vasodilation, improving blood flow and decreasing blood pressure. So how do we get L-arginine? So this is really important because L-arginine is an amino acid that the body uses in the biosynthesis of protein. So there's several ways to obtain it. First is endogenous synthesis of L-arginine. So the human body naturally produces L-arginine through the urea cycle. However, the amount synthesized may not always meet the physiological demands, so especially during periods of growth or recovery or illness. And so this is where dietary sources are going to be really important, and they can be consumed through the diet. So high protein foods are excellent sources of this, thinking of your red meat, your poultry, your fish, your dairy products, even some of your plant sources like nuts, seeds, soy products, legumes can also be sources. And it's also known as a conditionally essential amino acid because while it's generally considered a non-essential amino acid because it can be synthesized in the body, it sometimes can be considered conditionally essential because in certain instances like illness or injury, the body's requirement of L-arginine may exceed the ability to produce it, which therefore makes dietary intake very important. So now let's talk about the enterosalivary pathway, which is nitrate to nitrite to nitric oxide pathway. So when we ingest nitrates from our diet through things like celery, beets, or arugula, we are going to, of course, have saliva production. So with the saliva production, it's going to concentrate nitrates about tenfold from plasma, and it's the first step of nitric oxide production. Ultimately, you're going to have nitrates that are in the saliva that are reduced to nitrites by commensal bacteria in the mouth. So this is going to be our anaerobic bacteria that is on the posterior aspect of the tongue. Then it is going to move down to the stomach, and in the acidic environment of the adult stomach, which is a pH of about 1 to 3, the nitrates from the saliva are further reduced to nitric oxide. Ultimately, when we move into the small intestine, we're going to have absorption into the bloodstream, and these nitrites are then absorbed into the bloodstream via the digestive system. We then are going to have blood tissue utilization, so the nitrates in the bloodstream are further reduced to nitric oxide, especially under hypoxic conditions, which occur when tissues, of course, are having lower oxygen levels. And then there is a kidney reabsorption. So the nitrates and nitrates are reabsorbed in the kidneys, completing the enterosalivary circulation of nitrates, and then that contributes to maintaining nitric oxide in the body. So now let's get into the 6 ways that you can optimize your nitric oxide. So the first one is going to be improve nasal breathing. So it's important to note that nasal breathing is way more effective than mouth breathing for delivering nitric oxide from the sinuses to the lungs, because mouth breathing bypasses the nasal cavity, where is the highest amount of nitric oxide. So this is where we talk about the alternative pathway, which essentially is the parasinus pathway. So nitric oxide is essentially synthesized in the paranasal sinuses within the endothelial cells. This is going to create an accumulation of nitric oxide within the sinus cavities when we are nasal breathing specifically. When we inhale our air through the nose, the air is going to pass through the nasal passage, pick up the nitric oxide from the sinuses, transport it to the lungs, and this nitric oxide enriched air is traveling via the trachea into the lungs to ultimately help regulate the function of the airway and blood vessels. So then, of course, we can have more systemic effects from this, creating more vasodilation throughout the body. So as I mentioned, nasal breathing versus mouth breathing is very critical. So what you can do with your patients is go through a simple airway screen. So the first thing you'd look at is, are they nasal breathing or are they mouth breathing? So you can have them place a hand on the chest, hand on their abdomen, have them take a deep breath, see what their natural pattern is. And then the follow-up to that is, are they able to breathe nasally for 3 minutes? So if you didn't have the time to do that in the clinic, you could have them do that at home and see if they're able to. Additionally, you want to look at the nasal valves. So from here, you want to think about having them breathe in and breathe out, and you can watch what's happening. Are they getting sternocleidomastoid mastoid involvement and neck involvement, upper trap as they're breathing? Is it an upper chest breathing pattern? Then you can have them pull the lateral wall of the nasal cavity. So you're going to put pretty good amount of pressure here and pull apart, and then have them breathe in. And if that feels significantly easier, then you know that there might be an issue with the nasal valves and potentially turbinance. So this could be anything from a deviated septum to the actual nasal valve, but you want to assess is there any type of nasal obstruction? This is a really easy way to do it. And most people will notice a significant difference when they do have an issue and they do this. It feels so much easier to them. The next thing is looking at any kind of TMJ patterns. So if you have them open and close their jaw, does it look symmetrical? Are they able to open fully and close fully? Do they have clicking? Do they have popping? All of these things are signs of some kind of airway dysfunction. Additionally, you can look at the Malampati score, which if you look at this picture here, you can look at the grade 1, 2, 3, and 4. So we're typically looking at this to see, is there an obstruction with the tongue in the soft palate? So here you can look at on a grade 1, when you open, you should be able to see the uvula and the soft palate very easily. When you get down to a grade 3 or 4, you aren't able to see anything in the back of the mouth because of the tongue position. So this is going to definitely warrant looking a little bit more into detailed airway evaluation and scans to see if they have upper airway resistance or obstructive sleep apnea. Then you also want to look while you're here, is there any tonsil hypertrophy? Do they have good tongue range of motion? So if they're able to open their mouth completely and be able to bring their tongue to the roof of the mouth. Do they have full range of motion in their tongue, or are they hardly able to get their tongue to the roof of the mouth while their mouth is open? Then we want to look at, do they have a narrow palate? So you can look at the upper palate. You can also look at the lower palate to see if there's a really small palate, potentially some jaw issues. What kind of tooth wear do they have? So are they grinding and clenching? Do they have crooked teeth? And of course, this could all warrant a sleep study, but you can do a basic airway screen to just determine if the person in front of you is able to nasal breathe. So the other things that you can do to optimize their breath is to first teach them about tongue position. So resting tongue position should be on the roof of the mouth, gently touching the top teeth with your teeth just a little bit apart. So they should not be clenched together. So this is the resting position, which, believe it or not, most people do not have their tongue here most of the time. So this is a really important thing to be able to teach them and potentially also train one of the strongest muscles in their body, which is the tongue. We can also use nasal dilators. So these are really, really powerful, especially when you're performing this test. If it's significantly better when they do that, then a nasal dilator will perform the same exact way. So it will help to create a little bit of space, so you can do that not only with sleep, but also with your exercise and performance. So I have a lot of my athletes wear them for cycling or wear them for marathons, races that they're doing, even strength training, if they have some kind of structural abnormality related to their airway. So nasal spray can be great. So there are specific nasal sprays that will have a xylitol in them that will also help to not only kill bacteria, but also keep the nasal cavity moist. Something like Xlayer can increase the peak airflow up to 35%, which is really powerful. If someone is mouth breathing, especially at night, you can switch them. If you address some of these things, you can also assess mouth taping. So I always do this in stages. I do nasal dilators first, normally a nasal rinse, and then I will try, if I think is appropriate after doing an airway screen, I will try the mouth taping to see if that is helpful. And if it's not, then they might need to be referred. But overall, you also want to just address whatever airway dysfunction that might be happening is, so that you can really promote nasal breathing, not just for nitric oxide, but overall health as well. And so now we'll get into humming. So what's interesting with humming is that although there was not a lot of research in this area, this does very much complement the breathing and the nasal breathing. So this was a study that looked at 10 healthy non-smoking subjects. So obviously very small subject sample, and nitric oxide was measured in the oral and nasal single breath exhalations using a chemoluminescence system, which was developed to meet the criteria guidelines of the American Thoracic Society for exhaled nitric oxide. And humming caused a 15-fold increase in nasal nitric oxide compared with quiet exhalation. So I think what would be great is to incorporate your nasal breathing, of course, with humming. So I teach this a lot with my patients, is for, again, so many different benefits, but especially now that we can think of this from a nitric oxide perspective as well. You could breathe in through the nose and then exhale as you're humming. So I say as loud and long as you can. This is a great parasympathetic activity. So of course it's going to stimulate the vagus nerve, but it is also stimulating this nitric oxide production via the, of course, nasal cavity. But then also it's believed that the sound resonance and the vibration of the humming can also play an effect and a role in the nitric oxide production. So now we get into foods. So the biggest thing that we want to think of are our top nitrate containing foods. So I like to think of this very simply, is that if we could focus on more fruits and vegetables, especially vegetables in this case, this is one of the things that could be really, really powerful for nitric oxide production and including nitrates. So the biggest sources of our nitrates are going to be things like celery, beets, arugula, and spinach. So these are really common ones. And of course, there's more beyond that, things like cabbage and fennel, leeks, parsley. So there's definitely more, but these are the things that we want to try to make sure we have in our diet consistently to really optimize that nitric oxide pathway. And we do want to factor in things like soil quality, how the vegetables are grown, overall freshness, but, because obviously all of these are going to have an impact on the amount of nitrates available that is ultimately going to influence that pathway. Now, we also want to think about antioxidants. Now, this is great because it goes hand in hand with fruits and vegetables again. So nitric oxide is an unstable molecule that degrades very, very quickly in the bloodstream. So it must be constantly replenished. So when we can try to address all of these things, we can really make an impact. So one way to increase its stability is to limit its breakdown. And so antioxidants are molecules that neutralize free radicals, which contribute to the short life of nitric oxide. So this is called reactive oxygen species. So these antioxidants, of course, are found in our plant origin. So fruits, vegetables, nuts, seeds, and grains. And some of our biggest ones we want to think of is vitamin C, vitamin E, glutathione. These are some of our big ones that we want to really try to optimize. So now let's talk about the oral microbiome. Okay, so when we are eating the nitrates, as I mentioned earlier, we are in our saliva, we are going to begin this process of nitric oxide reduction. So this is going to ultimately happen via this anaerobic bacteria in the posterior aspect of the tongue. So it is really important that we are optimizing our oral microbiome. And of course, that means our basic things like brushing our teeth, ideally twice a day or more. That could mean flossing our teeth. But the other things that we want to consider as well is avoiding mouthwash. So mouthwash can actually completely abolish the enterosalivary pathway. So that can mean no nitric oxide production and even an increase in blood pressure. So in one study that they did after mouthwash, oral nitrate reducing capacity was nearly abolished, 90% reduction for both nitrate doses compared to pretreatment values. So the other things that we want to factor in is tongue scraping. So tongue scraping 1 to 2 times a day can actually increase our bacteria that is going to help with nitric oxide production. And spitting versus swallowing our saliva can potentially change our systolic blood pressure. So we want to swallow our saliva versus spitting our saliva. So as I mentioned with the tongue cleaning, so it does have a significant impact on the tongue bacterial community composition, and daily cleaning once or twice a day can result in an increased proportion of H. parainfluenza and other proteobacteria, which are the major nitrate and nitrite reducing species of the oral cavity. So really fascinating. So we can think that tongue scraping actually can help us. So now we want to think about optimizing digestion and absorption. So this is going to strongly depend on the patient that is in front of you, but we want to think of some really basic strategies. I always recommend to my patients that you take 3 diaphragmatic breaths every time you eat to bring blood flow to the digestive tract, truly put you in a parasympathetic state for rest and digest. Next is chewing your food 20 to 30 times and really trying to optimize your natural digestion processes, and walking afterwards, some kind of gentle movement afterwards to really complement digestion. And the biggest one is avoiding antacids. So this can have a significant effect, as you can appreciate from our pathways, on nitric oxide production. So we really need the optimal acidic environment in our stomach for this conversion. So it's really, really necessary that if you have someone that's on antacids, that we're working, of course, to identify what the root cause is for their issue. Do they have H. pylori? Do they have low stomach acid? Do they have some kind of food intolerance, sensitivity, allergy? What are the reasons that they're having so many issues? And even, of course, things like optimizing digestion. And then we, of course, want to replace with pancreatic enzymes or HCl or even bile salts as necessary. So this could be based on some of our tests like the GI map, for example, or looking at more specifically what is happening with their digestion. So do they have increased fat in their stool? Do they have low pancreatic elastase? So we want to really make sure that we're doing everything from a natural digestion perspective, but then also looking to see how they are digesting their food, clinically speaking, from a testing perspective. So last but definitely not least is exercise. So historically, we know that exercise has had a profound effect on our cardiovascular system. So this is going to be no different. So this was a systematic review and meta-analysis of 25 different studies looking at the effect of exercise training on nitric oxide and nitrate/nitrite, the NOx production. And what they found was that based on the eNOS gene expression, that regardless of exercise duration, length, and type, aerobic training or HIIT training, exercise can significantly increase serum nitric oxide levels and NOx levels. So this goes to show that exercise, once again, is always a win and is going to be super important in our overall nitric oxide production. And the other thing that we want to factor in is called the NODE, the nitric oxide dump exercise. So this is a very well popularized exercise that was based on a study that they did. And essentially it is these 4 different exercises that you're supposed to do at least 2 to potentially 3 times a day. As it's been popularized, it takes about 4 minutes to perform, although in the study it did take them 14 minutes to perform. But what they found was that this did have a significant improvement in the systolic and diastolic numbers as it relates to hypertension. So it is a really cool exercise. So you can check out this video here. To perform the nitric oxide dump exercise, the NODE exercise, you're going to start with performing each exercise for 10 repetitions, and you're going to repeat the whole thing 4 times. So the first one is a squat. So as you're performing the squat, you can squat as low as feels comfortable to you, obviously paying attention to mechanics, making sure your hip, knee, and your foot are in line, and allowing the arms to raise to shoulder level. Then after you perform 10 of those, you would move into the circular arm motion. So you can start with your pinky together and bring your arm overhead like this. So of course you do want to be mindful of your shoulders. So you can modify this by changing the range of motion that feels comfortable to you, even bringing them out in front slightly. You can do that. Again, being mindful of mechanics so you do not cause any injury with this, but working on 10 total circular motions. Then you'll move into a shoulder press. So from here, starting with your arms bent, pressing overhead, like you're pressing something overhead, an object. And again, bringing your elbow slightly forward can accommodate for proper shoulder mechanics, working in a scapular plane. And then the last one is a march. So you can tap with your opposite arm. So this you would do 10 each. And then from here, you would repeat this whole cycle. So you would move back into your squats. You move back into the circular arm press. So you would do, again, 10 each. And eventually working on speed with this. So this is going to take you approximately 4 minutes or so when you're doing this repetitively. So once you feel like you've done that, you're going to feel like everything is pumping. So allow yourself to just really settle in and feel your body, feel this tingling that you'll notice in your hands and typically your hands and your fingertips, noticing this vasodilation that's occurring and really work towards increasing speed over time. And of course, even the endurance piece. You can add to this in terms of repetitions. You can repeat the cycle more frequently, working up to, in the study, they did a total of 14 minutes. So lastly, I want to finish with a case study. So I was working with a marathon runner, triathlon competitor who was in his early 60s. So he was actually in a bike accident and had a pretty significant trauma where he fell onto his rib cage and he had a pneumothorax. So he was managing that for some time, but then months later realized that he still had actually quite a bit of fluid in his lungs and he was having some pretty significant issue. Now, this is a person who was doing a race every month. So whether that was some kind of triathlon, that was a small 5K, that was a marathon, but every month, every year for years. So really, really high level. And his biggest concern was that he said his training effect is much slower and less efficient. So he feels like he just can't breathe very well. He's having a hard time getting back to where he used to be. And so this is really interesting because he also had, through his history, we found that he had hypertension, he had hyperlipidemia. So he had a lot of different symptoms that were pointing to a nitric oxide deficiency. So as we were digging in, he also reported that he was recently diagnosed with asthma, but had never been diagnosed with asthma prior to this. He was having some blood pressure dysregulation. And again, his biggest concern was this poor endurance and training effect that he's so used to. So he would be able to train, know exactly what he needed to do to reach that next level. And he just hasn't been able to do that. Now he does have quite a significant alcohol use. So he was drinking about 14 drinks a week. And so what we wanted to do is I tried to get some of the labs that he already had and integrate everything. We also did an airway screen to be able to get a better assessment. And of course, there's airway issues. Definitely has a nasal obstruction. So that was pretty significant. So what we did was I did several interventions. So the first is we did a beetroot supplement. So that was really to address the nitrate food. But I also encouraged him to eat nitrate-rich foods. So I gave him a list of things that I wanted him to start to include. So he started to include those in his shakes and things like that around his pre and post workout. He was on a statin, so I did recommend CoQ10, which bonus to that is, of course, it's diminished when you are on a statin, but in addition to that, it is an antioxidant. It's going to help with mitochondrial function. So that was a big, that was a really important one. Fish oil. And of course, I suggested decreasing the alcohol intake at least 1 to 2 per week, and also encouraged the cardiometabolic food plan. So he was already a pretty decent eater. So it's really just trying to maximize things and really focusing again on some of these nitrate-rich foods. And then we also did the nasal dilator. So I used Mutes plus Xlear. So Mutes can increase peak airflow about 38%, as well as the Xlear, which again can increase peak flow about 35%. So together they make a really, really strong win. So even after implementing all these things, after just a couple weeks, he was already noticing energy levels had changed. He was noticing improving in his breathing, and he was working towards incorporating the Mutes with actually using them for performance. So he was just trialing them. He also was trialing when he was taking the supplements. He initially had taken the beetroot supplement later at night and realized he was having some sleep issues. He was still trying to work through some things, but ultimately this is going to be a really good track for him. There's still a lot of different areas that we have to work through, of course, but looking at this from a more global perspective. So looking at his airway and making sure we're optimizing nasal breathing for him, increasing his foods, making sure that he's increasing protein was one of the other interventions that we talked about. So he was eating pretty low protein amount overall. So optimizing his high quality protein sources, so that can help with the L-arginine, for example. So really just looking from a multifactorial perspective, and we will start to incorporate more and more and monitor specifically his blood pressure, his performance, and obviously some of his other cardiometabolic numbers. So to summarize, nitric oxide is an essential molecule that is required for overall health. And as a vasodilator, nitric oxide signals to the blood vessels to relax, allowing them to expand. And so when you perform, let's say, the nitric oxide dump exercise, which I encourage you to do, you will feel that exact feeling. You will feel this sense of tingling. You will almost experience the sense of vasodilation. It's hard to ever talk about that, but when you actually perform that exercise, you can really experience it. So this effect is going to allow blood and nutrients and oxygen to flow freely to every part of your body. And when nitric oxide production is decreased, your health really can become compromised. Hopefully you can appreciate that. So it is really important to, when you're looking at your patient's history and you're really trying to put all the pieces together, to factor this in and think about all of these things that you can do to optimize their nitric oxide production, from exercise to breathing and humming to optimizing their oral microbiome, their gut microbiome, their digestion. All of these things are going to really have a positive approach on their overall health. So thank you so much for joining me today. I hope this was helpful, and I look forward to seeing you again soon.